Diabetes 101, everything you need to know in 5 minutes. What is diabetes? Let's break it down simply. Diabetes is a long-term condition where your body has trouble managing blood sugar levels. It all comes down to a hormone called insulin, which helps sugar move from your blood into your cells for energy. But with diabetes, either your body doesn't produce enough insulin or the insulin doesn't work like it should. And when sugar can't get into your cells, it builds up in the bloodstream, causing health problems over time. Why does diabetes happen? Diabetes develops when the body struggles to use insulin properly or doesn't make enough of it. As a result, sugar remains in the blood instead of being used for fuel. Over time, this can lead to heart disease, nerve damage, vision problems, and even kidney failure if left untreated. Types of diabetes you should know. There are 4 main types of diabetes. Type 1 diabetes. This is an autoimmune condition. The body attacks the cells in the pancreas that make insulin. It usually shows up early in life, and people with type 1 will need insulin daily, for life. Type 2 diabetes. This is the most common form. In type 2, the body doesn't use insulin well or doesn't make enough of it. It's closely linked to lifestyle, lack of exercise, poor diet, and excess weight. Gestational diabetes. This form appears during pregnancy. While it often goes away after childbirth, it increases the mother's risk of developing type 2 later on. Prediabetes. Think of this as a warning sign. Blood sugar is higher than normal, but not quite in the diabetes range. Without lifestyle changes, prediabetes can become full-blown diabetes. Who's at risk? Some people are more likely to develop diabetes than others. Key risk factors include having a family history of diabetes, being 45 or older, being overweight or obese, leading a sedentary lifestyle, eating too many sugary or processed foods, having high blood pressure, a history of gestational diabetes. If these sound familiar, it might be time to take action. Diabetes and the glycemic index, GI. Not all carbs are equal, and that's where the glycemic index comes in. It ranks foods based on how quickly they raise blood sugar. High GI foods spike sugar fast. Examples include white bread, soda and sugary drinks, white rice, candy and sweet snacks, regular potatoes. Low GI foods are digested slower, offering more stable energy. Brown rice and oats, leafy greens and vegetables, apples, berries, beans and lentils, sweet potatoes. Choosing more low GI foods can help you manage or even prevent diabetes. Treatment and management options. Managing diabetes isn't just about medications, it's about lifestyle. Here's what helps. Insulin therapy, especially for type 1 or advanced type 2 cases. Oral medications help the body use insulin better or reduce sugar production. Healthy eating. Focus on whole, fiber-rich foods. Regular exercise. 30 minutes a day makes a big difference. Glucose monitoring to track patterns and adjust accordingly. Weight control. Even small weight loss can boost insulin sensitivity. Hydration. Drink water regularly and cut out sugary drinks. Can diabetes be prevented? Type 1 can't be prevented, but type 2 often can. Here's how. Stay active. Movement improves how your body uses insulin. Eat smart. Load your plate with vegetables, lean proteins, and healthy fats. Watch your weight. Losing even 5 to 10% can reduce your risk. Get regular checkups. Early detection is key. Small daily choices really do add up over time. How is diabetes diagnosed? To find out if you have diabetes, doctors use several blood tests. Fasting blood sugar test measures blood sugar after not eating overnight. Normal, below 5.6 millimoles per liter. Prediabetes, 5.6 to 6.9. Diabetes, 7.0 or above. A1C test shows average blood sugar over 2 to 3 months. Normal, below 5.7%. Prediabetes, 5.7 to 6.4%. Diabetes, 6.5% or higher. Oral glucose tolerance test, OGTT. Blood sugar is checked after drinking a sugary drink. Normal, below 7.8 millimoles per liter. Prediabetes, 7.8 to 11.0. Diabetes, 11.1 or above. Random blood sugar test, High levels, 11.1 millimoles per liter or more, may point to diabetes, especially if symptoms are present. Final takeaway. Diabetes can be serious, but it doesn't have to control your life. With early diagnosis, healthy habits, and proper care, most people with diabetes live long, active, and fulfilling lives. Knowledge is power. Take control today, and your future self will thank you. If you find this video helpful, give it a thumbs up, like, comment, and share.